Hello. Thank you for joining the transfer process training. This is from Gold Cross Ambulance. My name is Heather Stenbrot. I'm the administrative director, and we're going to go through how to request a transfer through Gold Cross. So first, in order for you to request a transport, we need to make sure that you have an accepting physician and room number. So these are needed and required prior to starting that process. Okay, we are going to go into the use of the platform that we use for requesting transfers. This is called StatCall. You can access this website from a few different places, but if you've never used it before, you can go to goldcross.org, and there is a link in the upper left-hand corner there that says StatCall that you can click on, and it will bring you to the website. Otherwise, you can also save it as a favorite. It's statcall.goldcross.org. Also, for new users, if you haven't used it before, you can request access by going to the Gold Cross website. You go to About Us right underneath StatCall to Hospital Resources, and you'll just fill out a quick form. And then we will get you added into the StatCall access. Also, another note is that your username is set when you created your account. So it might not be your email, but if you did use your email as your login, then it would be that. Okay, so this is what the website looks like. This is a screenshot here. This is the actual StatCall login page. You'll enter your username and password. If you don't remember, you can always use that forgot password, and it will go to the email that you signed up with. After you enter, you'll get transferred into this page here where you'll see the order transport button. This big blue button here you would click on to start your transport order. Okay, this next full section is going to be what you're going to see when you log into the page. And I'm going to go through each area so that you understand what we're looking for or maybe why we're looking for it. So the first section, when you go to request a transport, it's the acuity level. This is the level of the transport, and we give some definitions below to help you choose the right one. It is imperative that you choose the right one here because it will get you the right crew, it will get you the right resources, and it is very important that it's done accurately. So your first option and your highest acuity is that code. These are your highest acuity transport for immediate life-saving interventions with activated codes. So these are STEMIs that are going directly to cath lab, ruptured triple A's going to the OR, code OB for hospitals that don't have an OB department, code strokes that are going to cath lab or IR, code traumas that are going directly to OR. So if it doesn't have an activated code or not going to this intervention with that activated code, then that is not the section you would choose. So these are your highest level. Next are your emergent transports. These are emergent conditions requiring life-saving interventions that are not cold calls. So can be equally as important because they are going to definitive care for life-saving interventions, going directly to surgery, IR, or cath lab. Examples of these are going to be your dead or perforated bowels, your cold limbs, your NICU transfers. The next level is urgent. So these are immediate consults or critical care, but not emergent surgery. So these are going to be non-STEMIs going for a cardiac consult, sepsis going to the ICU, or traumas that are going for trauma consults. And then non-emergent. This is going to be for your patients that are going for ongoing care at a higher level than you're able to provide at your facility. So these are going to be transfers to your medical surgical floors, your cardiac floors, your mental health floors, going for observation. Your transfers to cancer or radiation would be those non-emergent. Next is your non-medical cot transports. These are discharges. These are not inpatients. These are discharges requiring a stretcher transport, but without any medical need. So these are 2 non-medical staffs, but require a stretcher. Just something to note there, you have to have less than 2 or less steps at that destination. They cannot accommodate more than 2 steps. And then lastly, our wheelchair non-medical transport. These again are discharges requiring a wheelchair transport. Required to be able to sit up in the wheelchair independently, and if they have oxygen, they need to be able to manage it on their own. We cannot accommodate stairs with this transport, and it is 1 non-medical staff member. So when you guys log in, each one of these definitions are included when you hover over each one of these acuities. So you'll be able to, you don't have to remember this. You can hover over and find what is appropriate for the transport that you're trying to organize. The next section is your pickup, super simple. As soon as you start typing in, you should be able to get a list. You can click on it and then the address will automatically fill in. You can do your pickup room, date and time. Drop off, same thing. If it's a facility, you can start typing in what the facility name is and it will automatically update the address. Notification. This is an optional section. This is designated individuals to receive notifications, like when they get approved, when our ambulances start to be en route, or when we're at destination. So this is just an optional section. Patient information. So your the patient's first, last name, and date of birth. This must be that legal name. This is going to be potentially what's used, or it is going to be what's used when we submit for insurance. So it needs to be their full legal name. You can also notice the red asterisks mean it's required for you to submit this. So ensuring that everything that has the red asterisk next to it is required information. This next section is the medical section. This is the only section that's shared with the crews at the time of assignment. So, and also there will be some hover to discover on that too. So if you hover over, it will explain what it's needing and maybe why it's needed. So this section is going to determine also the kind of crew we're going to send you. An EMT crew, a paramedic crew, nurse or critical care crew. So it's really important that this information is accurate so that the crew gets the right information, but also we can send you the right resources. The weight and the height is essential just to ensure we have the right equipment and equipment selection for you, or if we would need to organize a bariatric transport or something of that sort. So ensuring that that weight and height is in there. The admitting diagnosis, this is just help guides the crew for preparation. And the oxygen here. So this is going to also help clarify the need for equipment, type of crew you're getting. And so you have bariatric, ventilator, requires our critical care team. So if you click that, we know exactly what team to send you. IV, when you click on IV, if there is an IV, it's going to say number in your, but it's an open text box. So we would like you to include what type, is it a peripheral or central? Are there medications? Or is there going to be anything running at the time of transport? This will help determine what type of crew is needed as well. And then the cardiac monitor, is a cardiac monitor required during transport? If so, click that there so we can make sure we send you the right crew and equipment. And then this receiving primary nurse name and number. This is important so that we can call report at the destination, or if there's changing condition, and give them an update. That sending nurse is so that we can contact for patient or transport questions or potential delays that we're seeing, so to keep that nurse updated. So like I said, all this information is super important to be able to determine the type of transport we're going to send you, as well as this information is directly then shared with the crew that will be dispatched. Additional information. So this information is just for the dispatchers and is not included in the medical record. Maybe something that you want the dispatchers to know for the crew that they could pass along. So examples might be, is there specific or required PPE that might be needed? Is the patient combative? or confused, and you want us to be aware of that. Are there family members riding along? Those are all things and additional information you can put in here to let our dispatch know so that they can inform our crews. The internal notes section, so this is used for requested changes, updates. This is like a two-way text message communication. If we send it back to you, we're going to document exactly what's needed, and you can see that here. You can also add comments, like if there were any changes or questions on this, you can add in this internal notes section as well. Okay, so the rest here, we're going to go over. Every other section that we're going to continue on after this is what gets put on a physician certification statement. So historically, if you've been in the business for a while, you probably filled out a paper form, which is what it kind of looks like to the right. Well, everything that we are entering moving forward will get put into a form like that and sent off for billing. So this is very important. This is a federal document certifying that that patient cannot go by any other means, that the medical necessity is met per CMS guidelines. This section it will be sent back if it's not completed thoroughly and accurately. So we have to have this in order to accept that transport. Like I said, this used to be a paper form, and we are documenting based on behalf of that physician that we're certifying this. Okay, so that first section's additional patient information. So also moving, I can't customize anything else in this section because that is that federal form. So I'll just go through and kind of give you what each section is needed. That patient Medicare number, not required. I can't remove the field, but you don't have to put anything there. If it's a hospital-to-hospital transfer, describe the services at that second facility that are not available at the first facility. This needs to be specific. Insurance billers that are reviewing these claims do not know what kind of capabilities each hospital in the nation have. So you just can't say higher level of care or pediatrics. You need to be specific that that higher level of care that you're going for is not available at that first facility, but it is at that second. So if it's a bed capacity thing, you can say that, medical surgical need due to no capable beds at sending facility. If there is some kind of consult that you guys don't have at the originating facility, you need to say that. It needs to be, pediatric consult for services not provided at sending facility. It needs to be described that way. And then the next one is transferring to the closest appropriate facility. If you say no, it's just going to have you fill out why you're going there. So if the patient is going there because they want to go there, maybe they're from that area, or that's where their originating doctor is, or if you're keeping it in your system and you're transporting, but it's not necessarily the closest, you need to put that in here. This doesn't mean we're not going to take it. It just tells us who to bill. So that's important there. If it's a hospice patient, just noting if the transport is related to that terminal illness. Okay. The next section in that PCS is this a repetitive transport? We don't do these. You can always say no to this. So even those radiation transports, you don't need to worry about that as a repetitive transport. We do not schedule these out and use that same PCS. So, but I just can't take this out. Medical necessity. So this section describes the reason that you can't go by Uber or private car. Why is that ambulance needed? So if the ambulance is not needed, you can say that. This doesn't mean we're not going to take it or process it. It just tells us where to bill again. When you're looking at that list, the medical condition, this is the specifics that need to be done in the ambulance that cannot be provided by other transports. So example is, okay, seizures, right? People have seizures all the time that are potentially transported in private vehicles, but what is it that you need in the ambulance? You potentially need airway monitoring, cardiac and neuro monitoring, potential for an anticonvulsant. That is what you want to put there. What is provided in the ambulance that can't be done in an Uber? Again, another example is hemodynamic or cardiac monitoring for decline and treatment of a heart attack or chest pain. Those are all reasons that you potentially might need an ambulance versus a private car or Uber. Is the patient bed confined? Again, this will help where to send that bill. And then can that patient be safely transported by wheelchair van? Again, just kind of guides where this bill will be sent. This next section is additional conditions that might make it medically necessary for an ambulance transport. So if you chose IV, cardiac monitor, ventilator, or oxygen, it's going to automatically click them here for you in this section, which is great. But there might be other things that this patient needs monitoring in order to, that kind of gives them that more reason why it can't go by private car. So, you know, if they're needing potential pain management, combative, IV fluids monitoring, those kinds of things, these are sections that you should be clicking. This section has the most common errors. This is probably why it's getting sent back, if it is. So let's just spend a little time. This is the requesting provider attestation. If you check this box, you're saying that the patient cannot mentally or physically sign the service claim form. If you do so, you have to list the reasons why they're mentally or physically incapable of signing that form. And then this signature. This must be an actual signature of the person filling this form out. You are essentially signing on behalf of the provider that everything that you've entered is accurate and thorough. So it needs to be a legible signature. This section here for selecting the signing provider, everyone listed in here is an approved person to be able to fill this form out and request this transfer through StatCall. So a lot of times it's not necessarily the provider, right? But it might be a discharge planner, a nurse, a case manager. So if it's if that's what you are, make sure that you're entering what the provider type is. The signer's full name. It cannot be initials. It cannot just be your first name. It needs to be the first and last name or it will get sent back. All right, face sheet. This is that last section. You just upload the most current face sheet that you have, and then you can go ahead and submit. Let's say you're potentially needing more information from the nurse. You're a discharge planner or a case manager. You need more information. You can stash it, and it keeps everything you've already done and puts it in the stashed area, and you can come back to it. If you're ready to submit, you can submit, and you'll get notified that it is submitted. All right, let's take a look at how you can see the updates on your transfers that you put in. So you've submitted it. You're like, okay, I want to see if they've got it or where is it at. So this is this page after you submit. You can click on dashboard. I've highlighted it here. It's in the upper right-hand corner. That's going to get you to this section. Whatever you're logged into is going to come up right here. And these are going to be the trips that you've requested. So let's just go through kind of what each one trip status means. Stashed. If you stashed it because you wanted to come back to it or saved it, that's where it's going to show up there. You can click on it and reopen it back up. Review, you can see there's two looking like right here. This means that you've submitted it and you're waiting for the Gold Cross dispatcher to review. And then you won't see anything in pending. We don't use that. Once we review it, if we need changes, we'll send it back to you. And well, we will make comments and I'll show you where, and it will stay in the reviewed status, but you can always edit it. And then once we accept it, it will go into accepted. This means the dispatcher has reviewed it. All the documentation looks good. We've accepted the transport. Once we assign it to somebody, it will show up in the dispatched area. So we've assigned it to a crew. When the crew gets in their ambulance or transport and they push en route, that they're en route, that will show up now then in en route. Once they've arrived to your facility, they always push arrived and it will show up there. And then when they're starting to be transported at destination, each section of the way, our crews then update that status and you can see it all the way through transport in the progression. Okay, so let's look. Let's say you put one in and we need some changes. You forgot to put your full name in. So it's going to stay in review. And you're going to see these, we've got a comment here and a comment here. So this is where that internal communication will show up. So you can see that we've added a note in here. Okay, now we want to look at what does that note look like? You can either just hover and click on it, or you can go in under it, the actions, and you can either add a note or edit your trip. So let's say you looked at this and you said, oh shoot, you need to enter your the full name and last name. You can click on that and do edit and go back in and edit it and resubmit it. And then you can go ahead and add a note and say, updated changes met. And then we will get notified and then we can process it. Also, like, let's say there's potential communication. Otherwise, you can always use this note. It's like a little text message there. Okay. Okay. Well, that is the last of our training. I will also send a document for standard work as well. So if you have any questions, you can use that too for live training, and hopefully this helped. Thank you.